According to the Union Health Ministry, India has reported over 27,000 new COVID cases and 219 deaths in the last 24 hours. The country also has more than 3 million active cases. Following the surge in coronavirus cases in April-May, it appears that mass gatherings were still taking place. The Kumbh Mela, a religious gathering that takes place every 12 years, went ahead as planned in some parts of India. Well, joining us to talk about the situation there is Dr. Vishal Rao, a member of the COVID-19 task force, also the Dean Center for Academic Research, HCG Cancer Center. He joins us now virtually. Thank you for joining us on the program. Tell us, are mass gatherings to blame for the spike in cases, especially the ones we saw in April? What would you say went wrong in India on the COVID-19 front?
A very good evening to you, and thank you for inviting me for this program. I think what we fundamentally need to address in this endeavor of curbing the second wave or the upcoming third wave is very, very relevant for us to understand that this virus is a socio-economic virus. The more we run social activities, the more we run entertainment activities, the more it is going to spread. So overall, I think one of the biggest learnings we've had from the second wave has been that we will need to win this war at home and not in the hospital. And most of what we have been doing today, and I think today if you look at, for example, I'm representing Karnataka state, which has a population of about 6 crores. Now, even in a population like ours, today the positivity rate is at less than 1%. It's currently at about 0.5 with very few cases coming up each day. The key learning that we have done is now we've moved from COVID appropriate behavior to looking at transmission appropriate behavior, which is a combination of the COVID appropriate behavior plus that of vaccination passport.
Well, recently, the country placed a ban on religious festivals. I know you talked about transmission-appropriate behavior, but if we look at the Ganesh celebrations for districts posting higher positive test level to prevent a surge in cases, what other containment measures are in place at this time across the country?
So I think the most important and the most relevant thing that is being done in this unlock phase was the way Government of India has taken up the structured program in order to address various socioeconomic strata and businesses. Now, broadly to put it, the Singapore followed a similar model. It was called the end of the circuit breaker model, where in the first phase of unlock, we continue to do the unlocking by encouraging only economic activities and not social and entertainment activities. Now, by doing so, like for example, in a country like India, about 70% and more are people who live for day-to-day wages, and another 10 to 20% of them are mainly for month-to-month earnings who live for their rentals, school fees, families. So the emphasis that Government of India laid was that while we continue to work towards reducing the positivity rate and the R factor, we will need to focus on the economy at this juncture. And the most important emphasis that we've been talking about is that every economic zone will need to be run like a hospital or a clinic. And that's the most important aspect, that you cannot differentiate yourself from another business thing. All you need to focus is that whichever centers are running, whatever businesses, shops, they will need to run this as though they were running a clinic or a hospital. The second thing, and this first phase is called the safe reopening. Then comes the safe transition. If the positivity rate continues to be less than 5% across the state, in that case, we now know that we can slowly open up for social and entertainment activities in a very restricted manner, which is what in our state we are currently doing as per the Technical Advisory Committee guidelines. The final phase is to ramp up vaccination so that we touch the magic number of anywhere above 65%. Now, this is called the safe state. So, again, reiterating the fact that the end of circuit breaker model of Singapore talked about three aspects: safe reopening, safe transition, and safe state. I think in a systematic manner, we would need to address the community in the same order of encouraging economic activities, but not social and entertainment activities. And at the same time, give a lot of emphasis to education, which we've been talking about in our state and in the Government of India's report, that the four groups of children, the children who are urban children, the children who are rural children, street children, and special needs children, all of these need to be addressed together in order to give complete holistic justice to the management of the pandemic.
So it seems lots of holistic plans there with the government, and we do hope that it really works in stemming the tide also as vaccinations continue. We would like to thank you so much and hope that you can join us again in the nearest future. Thanks a lot for joining us. Dean Center for Academic Research, HCG Center, Cancer Center, Dr. Vishal Rao. Thank you for joining us on the program.
Thank you. Thank you.